Thank you everyone for joining. It is 2:30, so we will go ahead and begin. Thank you for joining the recommendations to stop the spread of COVID-19 webinar. My name is Christy Berger, and I am a child nutrition and wellness specialist at the Nebraska Department of Education, Office of Nutrition Services. Today's presentation will focus on recommendations to help ensure staff as well as the families that you serve remain safe while providing emergency meals during the COVID-19 pandemic. This webinar is the result of various surveys that we asked you to complete, as well as anecdotal questions and suggestions from our staff at NDE. Please note that information included in this presentation is based off of information and recommendations from the Centers of Disease Control, as well as USDA, SNA, and the Institute for Child Nutrition. The Nebraska Department of Education would like to strongly encourage you to work directly with your local health department. Your local health department will be able to assist you with any further questions you have in regards to food and staff safety. Too far, okay. Before we dive into the meat of the webinar, I would like to cover a few housekeeping items. We have placed all of you on mute to help reduce the potential noise and speaker feedback. Please ensure that your computer microphone or your telephone, if you're on the phone, are placed on mute. This will help ensure there's no interference and you won't accidentally start talking during the middle of the presentation. We are recording this webinar and hope to make it available for other people at a later date. But just so you know that this webinar is being recorded. Also, throughout the webinar, you can use the chat feature for any questions that you have. We have several of our specialists on the call and they will help you answer questions. There will also be time at the end of the presentation for questions. So you can also hold your questions and ask them live at the end. And with that, I'm going to go ahead and go to the next slide. Today, we will be discussing how you can protect yourself and others while working in food service. We will explain social distancing in the workplace and chat about what it can look like for food production. We will also be reviewing cleaning and disinfecting, as well as methods to keep food safe once it leaves your facility. At the end of this presentation, we will allow for questions, as I just said, but if you have any burning questions, feel free to put them in the chat box, and our consultants are going to try to mitigate those questions as they come in. I'm also going to do my best to make sure that all of you stay on mute throughout the presentation. So if you notice the mute button on your computer being indicated, that's just me, making sure that everybody stays on mute. And also, I would like to just thank you guys again for joining us today to learn a little bit more about how we can keep ourselves and the families we serve safe. As you guys know, the CDC recommends that we all take several precautions to help limit the spread of the virus. The first that we hear over and over again is this idea of social distancing, or keeping at least 6 feet apart between people. The second and the most important thing that we can all do at all times, but especially right now during this pandemic, is making sure that we keep up with regular hand washing. Hand washing, we know, is a big part of your normal work day, but now more than ever, it is important to make sure that hand washing is happening throughout the day. It is also recommended now that all employees wear a face covering of some sort when you're unable to maintain social distancing. And as we all know, that happens a lot in the kitchen. So wearing a face covering at work is highly recommended. Remember, a face covering protects other people from you. It is the best way that you can help your coworkers and other people that you know stay safe. Another thing to remember, if you sneeze or if you cough into a tissue, you must dispose of it immediately. Wash your hands after coughing and sneezing or blowing your nose. It's also really important to note that we have entered into allergy season, and a lot of us suffer with those seasonal allergies. So you need to make sure that you are able to take care of your allergies and know the difference between your seasonal allergies and the symptoms for COVID-19. Finally, I keep saying most important, but please stay home if you are sick. It's a good idea for you, if you are sick, to continue to monitor your temperature on a regular basis. Also, just to watch for pending infections. All of these recommendations are laid out in various resources, including the CDC webpage, as well as lunchassist.org, which I used a lot of the information from those two sources for this webinar. As I said on the last slide, it is extremely important to keep excellent hand washing happening at all times. And as you all know, hand washing is very, very important to reduce the spread of illness in food service. This includes things like hand washing before and after preparing food, hand washing before and after wearing gloves to prepare food, as well as avoiding things like touching your face. Remember, gloves are not a substitute for good hand washing. And at all times, remember to prevent the cross-contamination between food, surfaces, chemicals, anything. Hand washing is important when you go from one task to another, and wearing gloves does not replace the need for hand washing. As I mentioned before, the CDC recommends that everyone wears a mask when they are out in public or when social distancing is not a viable option. It is very important that you understand the proper way to wear a face mask. If you are wearing a cloth reusable face mask, it is your responsibility to make sure that that face mask or that cloth or handkerchief or whatever it is washed and cleaned regularly with hot water and soap. For example, my reusable face mask, I can put it into the washing machine with my clothing. A reusable face mask should be washed after every use. If you are using a single-use face mask, like a surgery face mask, a more paper one, that cannot be washed, but it is regularly sanitized, it is your responsibility to take care of it according to the specific sanitization instructions. Additionally, a face mask should cover both your nose and your mouth. So if you are wearing a face mask and it's not covering both of those areas, you need to be looking for a different one. You want both your nose and your mouth covered for proper face mask use. Now, how do we actually put on a face mask? I have been lucky enough that my younger sister is a nurse, and so we had a nice little training about how to don and doff a face mask, or how to put it on and put it off. So the very first thing you do before putting on a face mask is you wash your hands. As I said before, washing your hands is probably the biggest defense we have against any type of disease contamination, and it's very important when operating in food service during this pandemic. And it's also important to note that wearing a face mask does not replace your need for washing your hands, it actually increases it. So you need to make sure that your hands are clean before putting on a face mask. The other thing we want to do before putting on a face mask is to inspect our face mask and make sure it is clean and it's free of tears or holes. Also, you need to be made aware of which side of the face mask is supposed to face you and which side is supposed to face the public. The third step depends on the type of mask you are wearing. If it is a mask with loops, you hold that face mask by those loops. If it is a face mask with ties, you hold the face mask by the ties. And if it is a face mask with a strap, one strap, you hold the face mask by the strap. The next thing you do is you secure the loops behind your ears or the ties behind your head or the strap around your head. The whole goal is you don't actually touch the part that's covering your nose and your mouth, you try to only touch the part that goes behind your ears or behind your head. You then secure it by either letting it sit behind your ears or tying it into a bow, and make sure that it is on there comfortably. You do not want to be touching the face mask while you are wearing it. And if you do happen to touch it, say it's uncomfortable, it's slipping or what have you, you need to go wash or sanitize your hands, and most likely you need to replace the mask and change your gloves. Also, it is important, if the mask becomes damp or soiled, you will need to replace the mask. Finally, if you're having difficulty breathing, you will probably need to change your mask as well. If the mask is making it difficult for you to breathe, it might be too thick for you. So please keep that in mind as you are wearing your face mask. When removing your mask, similar to putting it on, you want to hold it by the loops, the ties, or the band, and remove them without touching the part that goes directly over your nose and your mouth. And immediately you're going to want to dispose of the mask or place it into a bag or some sort of receptacle for it to stay in until it's able to be washed or sanitized or whatever is the destination for your specific mask. Also, wash your hands after removing the mask. As you're going to see throughout the rest of the presentation, washing your hands is going to come up again and again. Remember, we say this over and over again, easier for us to say, but we really need you to do this. Do not come to work if you are not feeling well. We have heard a huge amount of, the list of symptoms for COVID-19 is long. We really need each individual to take the responsibility among themselves to protect others. So the symptoms of COVID-19 include, but remember, are not limited to fever of over 100.4, cough, shortness of breath, chills or shaking, muscle pain, headache, sore throat, loss of taste or smell, and really the list goes on and on, and the symptoms list grows weekly. Please be sure to stay up to date with information released by the CDC. And as I mentioned earlier, your local health department is going to have the best information for you and your community to help you understand if it's something that you should be worried about. Right now, the CDC recommends that you stay home if you have been exposed to a person or are living with a person who has tested positive for COVID-19. But please continue to reach out to your local health department on guidance on when to and when not to go to work. The local health department will have the most up-to-date information on how we are mitigating infection. And as you guys know, the information with this pandemic changes daily. It's really important to just stay informed and keep working with your local health officials. We hear this term social distancing a lot. It is your responsibility to do your best to adhere to these practices. So this means, when possible, try to keep 6 feet apart from others. In the food service industry, this may be a little difficult, but it is not impossible. Some kitchens are already set up and able to keep 6 feet apart between workstations. But if your kitchen does not accommodate these measures and these recommendations, consider some of the following suggestions. Maybe have staff alternate work days. Maybe some staff come Monday, Wednesday, and some staff come Tuesday, Thursday. Consider isolating teams from each other. This can be having team members work in separate rooms in the school, in the gym or cafeteria, or possibly in different buildings. For example, if you are in a district where you have multiple kitchens in different buildings, maybe some of your staff can work out of different locations. Another recommendation that we have a lot of schools doing, or a lot of sites doing, is to provide families with meals for multiple days, and this limits the contact between our food service professionals and the families. And finally, if someone is able to work from home, please do so. I recognize that food service is not something that can happen from home, but maybe there's something that we can do to get less people interacting with each other, allowing for more social distancing in the workspace. The next few slides will go into these recommendations a little bit further. So the first recommendation is trying to keep workstations at least 6 feet apart from each other. This may take some creativity. Can you set up workstations in different areas of the kitchen? This may be moving things around a little bit, but it just gives some more space between different employees. Can you flex to do different jobs in the kitchen? Maybe one person operates the oven, 1 or 2 people are in charge of chopping. How can we do specific jobs that would require less interaction and crossing between the different workstations? Even with these practices in place, it is still necessary to continue to wash and sanitize both hands and surfaces regularly. Here we have another example of how to keep staff 6 feet away from each other. You could nominate one person to do dishes only, or nominate one person to get things out of the refrigerator. You could have the dishwasher come only at the end of the shift. Any way that we can keep people physically apart from each other in the kitchen is going to help reduce spread. This slide particularly features workstations outside of the traditional kitchen. Maybe consider having staff set up workstations that are at least 6 feet apart from each other in a multi-purpose space. Multi-purpose spaces could be basically any other room within your school that, or site for those of you that are not schools, that is not being utilized at the moment since school's not in session. So in this particular example, we have these different stations set up in a cafeteria setting where they can keep 6 feet from each other. This allows them to still be able to communicate and work together, but it enables them to keep that 6 feet from each other. And since we are all practicing non-congregate feeding, there are spaces in your facility that can be used for meal prep since the children will not be there for different activities. Remember, as I said before, even with social distancing in place, you still need to clean and sanitize hands and surfaces regularly. This slide here shows a way that we can do social distancing during meal distribution. This slide features no contact food handoff. So the goal with no contact food handoff is to not come into physical contact with the meal recipient. You can, when you give food to families, try not to touch or reach into their vehicles. When you, so here on this slide, we have one person that is with the food and handing off the food from the table. We have one person who places the food onto the cart. The family then takes the food off the cart and places it into their vehicle. And once they drive away, the cart is sanitized. This is a good way to ensure that you are not physically coming into contact. There was a lot of suggestions about putting food into the back seat. We would prefer, if the families were able to do that themselves. It just helps eliminate that mixing of that close contact within the vehicle. No contact meal service can also be achieved using walk-up meal service. The same techniques are used by the staff, but you have the family stay at least 6 feet back, you put the food on the table, you move away, the family comes and picks up the food, and then after they leave, you sanitize the surfaces and start over. It's really important when doing walk-up meal service that you provide markings that allow the family to know where is a safe distance on the ground. I've seen a lot of really creative ways to do this, from stickers to chalk to cones, but allowing the families to know what's an appropriate distance is very helpful. Finally, you can also practice social distancing when dropping meals off to families. For a no contact handoff, Leave the food on the porch or in a designated spot for the family. Do not go into the home and do not make physical contact with the family, so no handshaking, that kind of stuff. And as always, remember to wash hands after knocking on doors, ringing doorbells, touching railings, anything like that. But the most important thing with home drop-off is don't go into the home. That allows you to maintain this social distancing. People who work in food service have a long-standing history of excellent cleaning and disinfecting practices. And now more than ever, these practices really need to be followed. Cleaning and disinfecting are two different things. You clean a surface by using soap and water. Cleaning should happen before you sanitize a surface. After cleaning, use bleach or quaternary ammonia solution to disinfect surfaces. Be sure to follow label instructions for your specific disinfectant solution. This may include things like keeping a surface wet for a period of time, or requirement for wearing gloves while handling the specific disinfectant solution. Be sure to clean and disinfect all commonly used surfaces. This includes like cooking equipment, tables, prep areas, utensils, and storage bins. It can also include other things like packaging materials, the box that food comes in when you receive a food order. All of these things should be assumed to be contaminated, and whenever touching those things, you need to make sure that you wash your hands so that you're not disinfecting other surfaces. A good rule of thumb is to pay attention to all the surfaces you touch throughout your workday, and then clean and disinfect those surfaces regularly. Other areas like tables, doorknobs, light switches, floor, walls, drains, your cell phone, keyboards are all areas that should be cleaned and disinfected regularly. Some of these we don't think about that often. So like I said, think about what areas you touch throughout the day and make sure that they are being cleaned and sanitized regularly. Bleach solution and quaternary ammonia solution are recommended by the EPA and are approved for food service operations by the FDA. It is important to always follow label instructions when mixing a bleach solution. For example, a bleach solution that we were working with was 1/3 cup regular bleach with a gallon of water. Or this could be 4 teaspoons of bleach with 1 quart of water. It is important to test your solution frequently to ensure that it has proper dilution. And finally, we're going to talk about some guidelines for keeping food safe. As already mentioned, over and over and over again, hand washing is our greatest defense against the spread of any type of infection, especially with what's going on right now. Be sure to wash your hands before starting work, during food preparation, when moving from one food preparation area to another, before putting on gloves or touching or removing face coverings, after using the restroom, after sneezing, coughing, or using a handkerchief, after touching your face or your hair or really anywhere on your body, before and after eating or drinking, as well as handling raw meats, poultry, fish, and after any cleaning activity. The last thing that we want is to introduce some sort of contamination, cross-contamination issue alongside of a pandemic. So in addition to washing your hands to prevent the spread of the virus, we need to also make sure that we are washing our hands and our surfaces to prevent cross-contamination. And this is just a short little video that reviews hand washing. In addition to hand washing, other personal hygiene methods are also very important to remember. Always wear clean clothing. Do not wear jewelry, watches, or loose clothing in the food prep area. Always make sure that your hair is pulled back and to keep all facial hair covered with hairnets. Also, cell phones are a big source of viruses and bacteria. Keep all phones away from workstations. While we are on this topic, please remember to clean your phone surface regularly. It is also important to consume food and drinks away from your meal prep areas. And finally, launder aprons after each meal service. Try not to reuse aprons for multiple days. We also need to discuss the use of gloves. As I mentioned earlier, gloves are not a replacement for hand washing. You are all aware that gloves, when used properly, can be used to help prevent cross-contamination, but this only works when you are actually using gloves properly. Gloves are intended for single use. It is also necessary to make sure that the gloves you are using are latex-free in case a meal recipient has a latex allergy or sensitivity. Also, when you wear gloves when handling food deliveries, you cannot go and use those gloves again for food preparation. So between receiving and food prep, if you're wearing gloves for both, they need to be different gloves. Also, you should not use the same gloves for serving food or when cleaning and sanitizing. Remember, gloves are single use and they should really only be used for one task. If that's cleaning, do not go wear the same gloves to serve food. Do not wear one pair of gloves basically throughout the whole day. If you're doing different tasks, you need to be changing your gloves. Other opportunities for changing gloves include shifting tasks when you return to your workstation, or if your glove becomes damaged or torn, or if you touch your face wearing your gloves, you need to change your gloves. Remember, it's just like preventing cross-contamination. We really want to make sure our gloves are not inadvertently spreading and causing more issues than they are solving. Hand sanitizer is a really hot topic at the moment. Hand sanitizer was kind of hard to find for a while, and at least now near me, you can get hand sanitizer a lot of different places, specifically in local breweries, which I find really interesting. Hand sanitizer is a wonderful addition to personal hygiene practices. Hand washing with soap and water is preferred, but using at least a 60% alcohol hand sanitizer is an acceptable option when hand washing is not available. Hand sanitizer is also important between changing of gloves, anytime that you may accidentally touch a mask or a face covering, as well as any time that hand washing, like I said, is not possible. So if you are outside doing no contact handoff, you may not be able to wash your hands between everything, but you are able to rub hand sanitizer and then don new gloves. So remember, hand washing, always preferred. Hand sanitizer, a great addition or replacement if hand washing is not available. Our goal as food service professionals is to not only provide nutritious food to our customers, but to continue to ensure that the foods that we provide our customers are safe to eat. It is important to educate our families about food service safety precautions and how they can keep themselves and the food that we send home safe. I have heard that many sites are sending home food for multiple days, which is awesome. That helps keep that social distancing and helps make sure that our contact is less with our families. I have also heard stories of sites sending home frozen items or foods that should be refrigerated upon arrival. It is important that we share proper food handling information with our families. That way we ensure that they know how to properly handle the food, how to properly reheat the food that they are receiving. There has been a lot of creative ideas as how to do this. I've heard of sending home emails to all your participants or social media posts. And some sites have sent home a little flyer with the meals that says this needs to be refrigerated, or this is how long you heat this up in the microwave. It is your site's discretion as to how to do this. We really encourage you to be creative and look for information that you can send home to your families. But remember, you have to assume that they don't know how to reheat that burrito that you sent home. So please give them a little bit of information as to how to do that. But the more creative, the better. How can we continue to share that information without increasing contact with our families? So these resources presented on this slide, so the Center for Disease Control and Prevention, the CDC, has an awesome COVID website that includes a lot of helpful information as to how to prevent the spread of the virus. Action for Healthy Kids, as well as the Institute for Child Nutrition, have a lot of resources as well that can help share safety practices with your staff. And then lunchassist.org was the website that I used a lot of information to put together this webinar. They have flyers and handouts and things that you can use to help educate your staff as well as the families on safety precautions, as well as ways that we can keep food safe when it goes home. I want to thank you guys all for joining us for this presentation. Several of our consultants are on the webinar here, and they can answer your questions about safety, keeping yourself and your staff safe. Please feel free to either unmute yourself and ask a question, or you could type your question into the chat box. Once again, thank you. And that's all that I have. I'm looking forward to your questions. All right, if there are no questions, we will go ahead and end the webinar. If you do have questions, please feel free to reach out to the Office of Nutrition Services or to your local health department, and we will do our best to help you with the questions that you may have. Thank you for joining us today, everybody.